Okay, all right, good morning, everybody. Welcome to this session. So we are here to talk about the health needs and assets assessments that have been done in the inner east of Leeds. So my name's Lauren. I work in public health in the localities and primary care team. I recognise some of you from different sort of partnerships locally, and myself and Chetna are going to be delivering this session today. As I've said already, it is being recorded just for those who've joined since. So we're going to cram in quite a lot to the session. So we're going to talk a little bit about what is a locality health needs and assets assessment for those who aren't familiar with that term. And then the main part of the session will be talking about the key findings from the 3 health needs and assets assessments that have been done across the inner east of Leeds. So they cover Bermondsey, Richmond Hill, Gipton and Hare Hills. And we'll also be talking about what happens next, so what the next steps are in terms of this work, including how people can get involved if they'd like to. Please feel free to put questions in the chat. As I've said, it's going to be quite a lot to cover today, so we might not have too much time to cover your questions today, but we're really happy to follow up on email after the session, and as we'll also talk about how you can be involved in kind of next steps as well. But do put your questions in the chat, and as we go, we'll try and answer them where we can. So what is a locality health needs and assets assessment? It's quite a mouthful to say that, so I'm not going to keep repeating it. But a locality health needs and assets assessment is a systematic way to identify the health and wellbeing needs, assets and priorities within an area, and also understand what the changes are required to meet the health needs of the people in that area, wherever possible, building on kind of existing assets that are already in the community. So it's an opportunity for us to bring together evidence and understanding into one place to make it as easy as possible for people to get that really real deep dive into that specific area. And it's really important because it helps to ensure that decision making and local practice is responsive to the needs of the people that are living there, as well as the assets in the community. They also influence service planning and commissioning locally and strengthen partnership working with those that are sort of all within that locality. And they provide lots of really useful data and evidence that can support funding applications, particularly for third sector partners who are in the area. Sorry, my slides aren't moving. There we go. So what is the process? So it starts out with a whole lot of data collection, which kind of we source data from a lot of different places, and we'll talk a little bit about that. So bring together data from various sources. We complete community and stakeholder consultation locally to understand kind of what local people are saying. We then do work to analyse that data and produce the report. So that's what we've done. And those reports are kind of almost ready to be published. And we're just moving into this sort of middle stage, which is sharing the findings. So going out and talking to partners like everybody here today about what it is that we found in these assessments, so we can start to think about what the next steps are. So that would then move into collective priority setting, so thinking about how what we found can influence the work that we do going forward as partners across these localities, and then take action and monitor and view the outcomes of those. So we've completed these assessments for a number of different areas recently. So obviously we've got the 3 areas that we're covering today. They've also been completed for Holbeck, Crossflats Park and Armley. So as a team, we've kind of done these assessments on different footprints. So some have done them on a ward footprint, and then others have done them on an MSOA footprint. That stands for Middle Super Output Area, and it's just sort of a statistical geographical area that's used for reporting and analysing, but generally I think it's about between sort of 5,000 and 15,000 people in that sort of area. The assessments themselves are really big documents. They're not really sort of designed necessarily to be read in one go. But hopefully they've been done in a way where you can kind of navigate to the chapters and sections that are useful to you in your work. And there's also kind of chapter summaries, and we've also produced executive summaries that has really high level data of some of the key findings to kind of help you see what has been found. So what's included, they'll all be slightly different, but on the whole, we've all got sections that cover demographics, so who lives in that area, what's the age structures, gender, ethnicity, languages, what GPs they're registered with. There's then content on social, commercial determinants of health, so that can include information about employment, income, education, housing, and tobacco and alcohol harms. There's then information on health-related intelligence. So that includes non-communicable diseases and mental health, as well as some child and maternity specific data. Information around life expectancy and mortality for the area. And then there's the community and stakeholder voice section, which looks into kind of what people in the community and partners have said. And then that's all brought together into key findings and areas of focus for that area. So we use lots of different sources of data to do this, and that includes data from GP clinical systems, local authority data, census data, and other ONS data. We're not going to be referencing our data today because we talk about quite a lot, but it can all be found in the main report if you are wanting to know the source of any particular data. So I'm going to hand over to my colleague Chetna, and she's going to talk about Bermondsey and Richmond Hill.
Yes, hi everyone. Thank you for joining us today, as Lauren said. It's really great to see lots of our stakeholders here with us today. So that's really fantastic. Thank you for that. There is a lot of information we're going to go through, so I'm going to whip through some of this really quickly. But as Lauren said, you know, the full reports will be available quite soon. So to move us on, Lauren. Thank you. Lauren's going to just switch our slides for us. So thank you for that. So in terms of, if you just move to the next slide, Lauren. I'm not going to talk through this slide, but I just want you to think about Bermondsey and Richmond Hill. It's one of the most deprived areas in England. I'm looking at this from a ward perspective. And so I'm going to start you off with a statistic. So a staggering 94% of people living in the neighbourhoods it's ranked amongst the most deprived 10% in the country. So if we had 100 people on this call today, 94 of those people would be living in those most deprived areas. So it shows you how concentrated poverty and disadvantage is for this part of the city. So how this is worked out is by looking at the index of multiple deprivation, or IMD. So I'm not going to go into it in a lot of detail. As Lauren said, we're going to just whip through slides. But basically, and a lot of our public health colleagues, I can see lots of you on here, you'll know this already. But we look at things like employment, health, education and crime. And how this is done is, so it's ranked according to LSOA areas, which are lower super output areas, populations of around 1,000 to 3,000 people. And what happens is you rank people according to the most deprived to the least deprived. And so if you think of our population in Bermondsey and Richmond Hill, we're in those least deprived, most deprived areas. So that's how it's worked out. So I just want you to think about that as we go through the slides, and there's some information there in terms of our population. So I'm not going to go through that slide, but if we move to the next slide, Lauren. So in terms of social determinants of health, and Lauren alluded to this, it's about really where people grow up, where they live, what kind of jobs they do, and how they age. So this is looking at those those factors that impact on our health. And when we look at employment, we can see in the area that half the population is active in terms of work, but we have over 40% of the population that aren't working. And this can be for various reasons. So it can be because of disability, it can be because people are looking after families, it can be long-term illness. And we also know that those who are working are often still economically deprived because they're claiming universal credit. So we have higher rates of people who claim universal credit compared to those in Leeds. We also have people who are in lower paid jobs. So when we look at that across the area and compare it to Leeds, we have more people in low paid jobs and less people in highly paid jobs. So again, that links to people experiencing in-work poverty. If we move to the next slide, Lauren, thank you. So in terms of social determinants of health, again, when we look at income, so income deprivation, we can see here, these are I've just listed here 3 of the LSOA areas where we've got the most deprivation. And we can we can see that in terms of children and deprivation and older people in deprivation, those areas are most affected. We have higher percentage. So you can see St Hilda's, Copperfields and Gartons has income deprivation affecting children of 62%. So half the population there are affected. We also know that in terms of housing, we have people who have less housing ownership, more people who are in socially and privately rented homes. We have a high concentration of cold homes and issues around fuel poverty. And when we think about our children, over 50% of pupils in the ward receive free school meals. So again, this indicates low income households and child poverty. So again, major issues in terms of income deprivation. We'll move to the next slide, please, Lauren. So in terms of social determinants of health, again, I just wanted to focus here on lone parents. And this was something new to me, I have to say, having worked in the area. We have the highest number of lone parents in the ward compared to Leeds. So often these lone parents are in rented accommodation, the majority in social housing, living in overcrowded conditions. And again, low home ownership, often in low paid jobs, so facing economic pressures which impact on children. And I know there is some work that's happening in the area around lone parents. I know our partners, Learning Partnerships, do a lot of work around lone parents. I think Emily is on the call today, so some fantastic work that's going on there as well. But yeah, I just wanted to highlight that really. If we move on to the next slide, please, Lauren. So in terms of crime, and we do have high rates of crime, unfortunately, in the area. So again, we have high rates of domestic violence and abuse in terms of, sorry, my thing is pinging there. So in terms of domestic violence and abuse, we have the 5th highest rate of police recorded domestic violence and abuse incidents in Leeds. We've worked heavily with Hatch, the local care partnership, and I coordinate the subgroup, co-facilitate that group with Eileen. We've done some fantastic campaigns around domestic violence and abuse with the local care partnership, because we've recognised that domestic violence and abuse is something that our partners talk about and is a key issue. So again, that's been, we've done some work there around DVA. So yeah, so that's another issue in terms of crime. And if we move on, sorry, I've lost my thread. So in terms of commercial determinants of health, and Lauren mentioned this again, so these factors are really about what's in the area. We know there's lots of takeaways. We know that there's lots of hot food places and off licenses premises, which impact on what people eat in the area. We know that we have high smoking rates, which is significantly higher than the rest of Leeds, and we have issues around obesity. So we know that if those places that sell, hot food, and often we get the feedback that children and parents, use hot food takeaways because it's an easier way to feed people and their children. So that's a big issue for us in our area, and that's again feedback we get from our colleagues and from communities. So yeah, major issues around commercial determinants of health. And if we move on, we've got the alcohol data matrix, not like the matrix. Oh, sorry. Not like the matrix we have in the Keanu Reeves film, but the alcohol data matrix, which our public health colleagues have set this up. And what we can do is by using the data matrix, we can look at rankings, and we'll talk about indicators in a while, and work out where there is higher rates of alcohol harm for our communities. And we get feedback around this impacting on our communities. So if we move on to the next slide, non-communicable diseases. And am I all right with time, Lauren? I'm not checking actually. Yeah, okay, brilliant.
Yes.
Brilliant, thank you. So in terms of non-communicable diseases, so here you've got health conditions that are listed, and this gives us how this is worked out is we're looking at prevalence rates. So by that, we mean people who are living with these conditions and who have been diagnosed with these conditions. So you can see for Bermontoft and Richmond Hill, we've got a ranking there out of the 33 wards. And for COPD and smoking, we are ranked first highest and second highest, respectively. So we've got within the top 10 there, we've got those rankings. So we're significantly higher than in Leeds. I'm not going to talk about cancer and common mental health diseases because Lauren's going to cover that in her section. But you can see there that we've got lots of people who are impacted by these diseases. And we know that by lifestyle changes, like stopping smoking and having a healthy, nutritious diet, and a change in your environment, then these things can be impacted, and we can help people to live happier, healthier, longer lives. But you can see there the rankings, unfortunately, for our area. And then if we move on to the next slide, we can see here life expectancy. So life expectancy is really about how long people are likely to live. And we can see here again, male and female, that we have differences in terms of how long people live in Leeds compared to Bermontoft and Richmond Hill. And we have a difference of 4 years for men and 5 years for women. So again, lower rates. And then all age mortality is really about showing how many people die in a certain group over a set period of death. So basically how common death is in a population. And again, we've got higher rankings there, which is double the rates of Leeds. Premature mortality is people who die under 75, and preventable mortality rate is those that could be avoided if public health actions were taken. So again, things like stopping smoking, physical activity, having a nutritious diet, reducing alcohol, and having vaccinations. So we can see here we've got really high rates compared to Leeds. So if we move on to the next slide. Maternity and infants. So Lauren's going to cover some of this. I'm just going to focus on oral health, and this is something that's been raised in our area by communities and stakeholders. People really worried about oral health for their children. So what we have is, for children, this is high rates of calls to 111, but then and the highest number, but then less numbers of children getting treatment. So you can see there's a gap there in terms of what's happening, and also in terms of respiratory diseases, again, high numbers of hospital admissions for respiratory illnesses. And I know that the LCP, again, the Local Care Partnership, is doing quite a lot of work around respiratory illnesses, and that's a priority for them that they're focusing on. So the next slide, please, Lauren. So community and stakeholder voice, again, some really fantastic feedback that we got from communities and stakeholders, and we did some brilliant focus groups with learning partnerships again, which really helped us to understand what our communities feel about living in the area and what they would like to have changed in their area too. So there's a quote there about how somebody feels about living in the area. And the next slide, please, Lauren. So key assets that people found, and again, this varied depending on neighbourhoods, but in terms of Richmond Hill, people liked being in the quiet neighbourhoods. In Bermontoffs, we found people like living close to the city centre, and people like the diverse communities as well. Next slide, Lauren, please. So I'm going to whip through these. And then key findings, again, I won't focus on these because they're quite similar, but we did have a lot of people saying that they wanted more activities for children and families, and lack of public transport was mainly an issue in Richmond Hill. In terms of older people, and Cross Green, that came through a lot, where people felt they were isolated because there wasn't the public transport to be able to get around. And then the final slide, I think I'm on. Oh no. And then in terms of stakeholders, similar things came through, but again, mental health was raised as a key issue in terms of cultural taboos and stigma, but then also recognising that there was long waiting lists. And also the other thing that came through was around language and communication, that people felt that having access to English classes was really important, but then being able to move forward in terms of employment was also critical to help people in the area. And I think that's then my next slide, which is my final slide. So yeah, so in terms of area of focus, you know, there we've got all the health conditions that I showed earlier, which are within the top 10, and then areas of focus in terms of the wider determinants of health. And so just to pick up a few of those, and what we've got in the area is a strong infrastructure. We've got loads of partners that we work with, whether that be learning partnerships or Leeds Refugee Forum, the elderly projects that exist, Better Together. There's so many that we work with. We've got a strong connection with all of those organisations, which, you know, will help us with the next stage of the assessments. But just to also mention thriving children and families, because you'll see when you look at the full assessment that we do have children who are not achieving, and we have the Best Start and we have Marmot City. So it's really, really important that we focus on children and families to enable us to make sure that children have the best start and that we can help them to live healthier, longer lives and to get the real opportunities that young people deserve in the area. So I'm going to stop there. There's more I could say, but we're going to move on because we've got Lauren to now talk about Gipton. So thank you, Lauren.
Thank you, Chetna. So I'm going to talk about Gipton. Some of you, if your partner's in Gipton, might be thinking, where's Jess? So Jess Dewhurst is the lead author for the health needs assessments that we did in Gipton. Jess is now on maternity leave, so I am going to be leading on the health needs assessment for this area while she's off. So for Gipton, we chose to do 2 health needs assessments on an MSOA footprint, a middle super output area footprint. So that covers Gipton North and Gipton South and Killingbeck Park. So just to try and help you get your bearings, this is a map showing those 2 MSOA areas. I've put on just a few kind of key places that people might recognise to help you get your bearings of where we're talking about. So right at the top, you're kind of like up towards sort of Easterly Road way. You've got kind of Catch in that corner, and then moving all the way down to the bottom, we've got the old fire station, which a lot of you will know. So this the area kind of it's about 1.5 miles from top to bottom, or about a 35-40 minute walk kind of to get from one end to the other of Gipton. Today I'm going to talk about Gipton as a whole, kind of recognizing that lots of people will work across the whole area, but I'll try and pull out where we found like real differences between Gipton North and Gipton South, because I think that's one of the real benefits of this, is that it starts to help us look into the kind of distinct communities and where we might need to focus different areas of work for Gipton. So Gipton has kind of often been thought of, compared to Hare Hills particularly, as a sort of predominantly white British population, and quite sort of, really different to its neighbouring Hare Hills. But what we've kind of looked at in this assessment is that that's changed quite a lot, and it's become a much more diverse area. So there's about 17,500 people across Gipton as a whole. We've got a really big population of young people, so a third of people there are aged 0 to 19. So it's really important when we think about the work we want to do, thinking about children and young people at the heart of that. Over half of the population are from culturally diverse communities. So I think that's something that probably surprises a lot of people, because as I said, people still think that it's quite a white area. But 30% of the population are born outside of the UK. Generally, on the whole, those who are born outside of the UK have been living in the UK for sort of 10 or more years, so a fairly settled migrant community, but might be new to Gipton as an area. And then there is some more kind of like newer migration. Between the 2 areas, Gipton North is more diverse and kind of is home to a larger South Asian population in general, whereas Gipton South has a larger kind of Black African communities. There is also sort of Eastern European communities as well across Gipton. So second to English, the most common languages here are Urdu, Czech and Romanian. Similar to Chetna has said about Bermondsey and Richmond Hill, almost all of the population are living in an IMD1 area. So that means one of the most deprived 10% places nationally. And there are also some areas, so Easterly Grove and St Wilfrid sit in the 1% most deprived nationally. So that's across the country, they're in the 1% most deprived. In terms of primary care, we might have primary care colleagues on the call. About half of the population are registered in the Bermondsey, Hare Hills and Richmond Hill PCN, and then the rest are split across Seacroft PCN and York Road. And then the kind of popular surgery, so we've got big population registered with Oakwood Lane Medical Practice, and also with Bellbrook Surgery. So moving on to social determinants of health, and starting with children, as I said, it's a really large young population there. Across the board, children are sort of not achieving as well in education when we're kind of looking across a sort of key stage 1, 2, and 3. And we also have a higher NEET rate, so that's children who are not in education, employment, or training. And in Gipton, if you look at a count of the children and young people who aren't in education, employment, or training, it's some of the highest in the city. If you rank the MSOA areas, I should say there are 107 MSOAs in Leeds. So when we're talking about ranking, kind of one being the highest numbers, it's out of 107 areas. So high NEET rates. We've got more than half of the working age population who aren't in employment, and quite a big chunk of those have never worked. And in Gipton North, that's as high as almost 50%. So that might mean that there's quite a considerable amount of work needed to support people back into work, or into work for the first time. Income deprivation affects about 28% of the population. And in Gipton North, that rate is close to 60% for over 60, so a really high proportion of people experiencing income deprivation who are older. And we've got higher rates compared to Leeds for both in-work and out-of-work universal credit claimants. So income deprivation isn't only affecting those who aren't working, it's also affecting those who are in work. And there's information about the kind of different occupations of people in the area, and it's sort of generally it's sort of like potentially lower quality, less stable occupations that people are in, which can then obviously impact their well-being to a large extent. Next slide. There is a really high rate of people living in social housing compared to Leeds. So it's half of the people in Gipton South are in housing that's managed by Leeds City Council or other social housing providers, and 38% in Gipton North. There is a really a long wait for high priority tenants. So in Gipton, the average is 3 years for a high priority tenant to be housed. And on average, there are 432 bids for a single local authority property. So lots of challenges with housing. And on the whole, the challenges seem to be more located in Gipton North in relation to sort of wider housing needs. We've got almost a third of households experiencing fuel poverty, and similar to Chetna's area, there is a higher rate of crime on the whole, particularly in Gipton South, but across Gipton altogether, there's a high rate of criminal damage and arson, drug offences, and violence and sexual offences. And there is also 1 in 4 incidents of domestic violence where a child has been reported present at the time. So moving on to commercial determinants of health. So this refers to sort of private sector activity that affects people's health, whether that's directly or indirectly, positively or negatively. And it includes how sort of commercial actors choose to promote their products and choices. So we've got a smoking rate, which is significantly higher than Leeds in Gipton. There are much fewer off licenses and hot food takeaways. Oh, sorry, that should say food, not foot. Much fewer of these in Gipton, particularly compared to Hare Hills, and sort of neighbouring areas, but obviously people still have access to those commodities around them. In terms of alcohol-related harm, Gipton South is ranked higher compared to Gipton North, and both areas are ranked sort of medium risk, but there seems to be evidence that in Gipton South in particular there are sort of current issues around drinking behaviours and alcohol harm, so that could be connected to different communities that live in the different areas, but definitely something to kind of be aware of. And the risk rating that Gipton receives is largely related to kind of vulnerabilities of the population, so a young population, children not in education, things like that. We've also got a rate of obesity, which is significantly higher than in Leeds as a whole. And just to note, because we're about to talk about kind of non-communicable diseases and other health data, so the 4 most modifiable risk factors for non-communicable diseases are tobacco use, physical activity, inactivity, sorry, harmful use of alcohol, and consumption of high fat, salt and sugar food. So that's why this stuff is really important, because it's impacting sort of health conditions that people experience in the area. So looking at some of those health conditions, as is to be expected, because it's an area of high deprivation, we have high rates of most health conditions. So the reds indicate that it's significantly higher than Leeds. This table is comparing Gipton North and its rank out of the 107 MSOAs compared to Gipton South and Killingbeck Park. And you can see on the whole, Gipton South ranks higher for most, Gipton South ranks higher for most conditions compared to Gipton North, and they all rank quite highly out of all the MSOAs for all conditions generally. There are some complexities with the data for cancer and for common mental health disorders. That's what CMHD stands for. So whilst generally we kind of assume that, well, we can see in the data that the sort of deprived Leeds, so the areas of Leeds with the highest deprivation, have worse health outcomes and sort of or ranks more highly compared to more affluent areas. With cancer and common mental health difficulties, it's not quite that simple. So I can't go into it fully today because we could probably do a whole session on this. But as you can see, for cancer, we generally see that areas of high deprivation actually have lower rate of cancer prevalence. And similarly with common mental health, if we look specifically at IMD1, on the whole, they are lower than Leeds. And that is sort of generally true for Gipton North, because you can see they're green, which means they are lower than Leeds. But interestingly, they're very different between Gipton North and Gipton South. So for cancer, you can see Gipton North has one of the lowest rates of cancer prevalence at 104th, while Gipton South actually is the 19th highest rate. So definitely something to look into more, and we'll be exploring that when we kind of take this further. But that could be linked to things like survivorship bias for cancer, and also low reporting rates for common mental health, and people not being able to or wanting to access support, and therefore they're not being included in the data. For those who are interested, lots of this data is available on a Power BI dashboard that we can share in the chat, that our public health intelligence team have put together, which is a really helpful place to go if you're wanting to find specific data. So we can show that, put it in the chat for you. So again, looking at sort of life expectancy and mortality, as expected, generally worse than Leeds on the whole. So life expectancy is kind of, about 72, 73 for males, and 75, much higher in Gipton South at 79. And I think these are some of the most stark findings that we've come across, because if you look at the difference between Gipton North and Gipton South here, particularly for preventable mortality rates, in Gipton North they are double the rates of Gipton South. So that's the rate of people who are dying from things that we would consider preventable. So that's really concerning. And also just generally, it seems that there might be sort of higher, the ranking for females in the area is higher than males often. So something around kind of women's access to healthcare potentially. And we found that premature deaths due to cancer in women are significantly higher here, and that's the second highest out of 107 MSOAs in Gipton South, and fourth highest in Gipton North. Maternity and infants, so we'll skip through this quite quickly, but this is really important. As we said, a third of the population are children and young people, so that's why this is so important. We've got a high rate of late booking for antenatal care, so that's people who are pregnant and not booking in for antenatal care before the 10 weeks or by the 10 weeks. We've got low rates of breastfeeding initiation and maintenance, low MMR uptake, And then sort of moving into early childhood, only about half of children are a healthy weight in year 6. And the rate of those children who are living with overweight or obesity is more than double the Leeds rate. So lots of children who are experiencing those issues. So community and stakeholder voice. Some key findings, so the assets that exist in the area, a positive sense of community, some good local amenities, access to green space, which is really positive, opportunities to socialise and get support, and regular buses to town. Some of the challenges that people face, sort of barriers to living well, quite a lot of people experiencing sort of feeling unsafe due to the issues of crime in the area, as well as antisocial behaviour. They have reported untidy streets and neglected infrastructure, a lack of activities for children and young people, dangerous quad biking, some challenges accessing primary care as well as NHS dentists, and also community tension, which has been an issue, as particularly over the last year, I suppose, between sort of new and established communities in Gipton. And some additional things that our stakeholders and partners locally identified was issues around cost of living, mistrust of public services, mental health came out a lot, and sort of issues of social isolation as well as substance misuse. So for Gipton, we looked at kind of what the health needs would be. We've tried to narrow it down. We kind of looked at the way we did it is we looked at where rates are significantly higher than Leeds, maybe even significantly higher than the deprived Leeds rate, how it ranks in comparison to the other MSOAs, and kind of the scale of the issue, so the prevalence per 100,000 population, as well as how it's changing over time. So is it increasing, is it stable, or is it decreasing? So the health needs that we've identified are obesity, diabetes, dementia, cancer, and mental health, as well as specifically in Gipton South, COPD. And then we've got the social determinants of health areas of focus, which are quite broad because these are things that we need to dig into a bit more with partners to think about where we can steer things and what we might want to focus on. But in general, it's sort of things around employment, skills, and income maximisation, people feeling safe and sort of having cohesive communities, looking at housing and the local community infrastructure, children and families, access to healthcare, and transport and connectivity. Because whilst sort of connectivity into Leeds was seen as fairly positive, people struggle to travel across Gipton, is what we found. So they're struggling to access things. And that is the end for Gipton. So I'm going to hand back to Chetna to talk about Hare Hills.
Yes, hi. Thank you. Thanks, Lauren. We've covered a lot of information and data, and I've got now Hare Hills to talk about. So again, I'm going to try and get through these slides quite quickly, just for time purposes. So Hare Hills, this assessment, focuses on 3 MSOA areas. So this is our colleague Mindy Gruel who's done this assessment. She's done a fantastic job in bringing this together. So the 3 MSO areas are Hare Hills South, Hare Hills North, Lincoln Green and St James. And so you can see here again a very high population of children, a third of the population that are under 19. And we've got a very culturally diverse community with many languages, over 137 that are spoken, and we have a significantly smaller population of older people than in Leeds. Next slide, please, Lauren. So in terms of employment, again, similar to what we've already discussed, half the population working, a third of the population of working age in Hare Hills is living in an income deprived household. And we've got, you can see there for the MSO rates for claiming universal credit, and for Hare Hills South and North is triple that compared to Leeds. We've also got their income in terms of Hare Hills, and some of the, you can see there again, in terms of deprivation affecting children and older people, we've got a higher percentage affected in those MSOA areas. Next slide, please, Lauren. So again, this just reiterates really what I've just said, and you've got the rates there. So it's showing you the rates for the working age population and deprivation according to those MSOA areas. We do have, similar to the other areas, we have in-work poverty as well. So you can see that that is an issue as well. And those who have never worked. So again, you know, high numbers of people who have never worked previously. Next slide, please, Lauren. In terms of education, next slide. Sorry, yeah. In terms of education then, again, similar to what we've already heard, where we have young people who are not achieving, whether that be through at foundation stage or in terms of qualifications, a high number of NEETs as well in the area, the 9th highest NEET count as well. So again, issues around children and being able to achieve in school. Next slide, please, Lauren. Housing, I know we've got Peter here on the call today, so housing, and those of you who work in the area will know we've got a lot of back-to-back properties, a lot of people who are, again, renting, whether that be privately rented homes or in Lincoln Green, St James's, where we've got also socially rented homes. And I notice we've got Helen, and we know we've done a lot of work around selective licensing as well in the area. So, yeah, key issues around housing, and we know how that impacts on health and how we feel about where we live as well. So next slide, please, Lauren. Crime, again, we've already talked about this, but we have high rates of crime. Lincoln Green, St James has the highest rate out of those 3 MSOA areas, so 238 per 1,000 population. So again, in terms of crime, we've done a lot of work with the Clear Hole Build initiative. Those of you who work in the area will know about that, where we focused on crime and also serious organised crime gangs in the area. So there's been a lot of work that's happened there. We also have high rates of domestic violence and abuse in the area as well. Next slide. Which is around tobacco. Again, as we've talked about, high use of tobacco, the highest rates in terms of smoking. So yeah, again, that's a major issue when it comes to commercial determinants of health. And the next slide, please, Lauren, talks about the alcohol harm. So again, this is the matrix that I was talking about, and you can see there the indicators that we look at when we talk about alcohol harms. And so when we've had licensing in the area, where we've had new licensed premises, and I've been involved in putting some of the public health licensing representations in with elected members and others, we often talk about these very high rates that we have. We know through our consultation that parents are worried for their children, so we use protection from harm as a key objective, and we've had some great success last year. I think we had over 15 plus licenses that were either revoked or not granted or giving conditions. So we had some real success there around stopping new licensed premises in the area. Next slide, please, Lauren. In terms of obesity, again, similar as we've talked about, high rates of obesity, which are higher than Leeds average, and hot food takeaways as well. And again, I know Hatch are doing some fantastic work around food in the area as well. Next slide, please, Lauren. So health-related intelligence, so this is the health conditions again that we've already talked about. So you can see here the rankings for Hare Hill South, North, Lincoln Green and St James. And you can see for CHD, we've got the third highest ranking for Hare Hills North. And for diabetes, it's the first ranking. And some of those areas are not significantly different. But again, we've got some high rates there, and cancer, common mental health, as Lauren explained. Again, the same for asthma, which is a bit surprising because we know we have cold homes and we have smoking, so you would think that would be higher. But again, this could be about lower rates of diagnosis or people not being able to access services. So that again needs a further exploration, really. Next slide, please, Lauren. So life expectancy, again, you can see the difference between Leeds and the three MSOA areas, and that we have, a 5-year gap for Hare Hill South, Lincoln Green and St James for men, and 6 years plus for females in South, Hare Hill South and Lincoln Green and St James. So a real variation there in terms of life expectancy. Next slide, please, Lauren. And mortality, again, we can see 6th highest rate for Hare Hill South, a 3rd highest rate for Hare Hills North, for coronary heart disease, and 4th highest for Lincoln Green and St James's. So next slide, please. So maternity and child specific health data. So again, similar things that we've already really talked about around late booking for antenatal care. And that came up a lot for our culturally diverse women, where women were coming late for their bookings, which then has an impact in terms of the services that they get and vaccinations and those critical discussions which are needed right at the start of pregnancy. And we could see that can have an effect in terms of what happens for women as they go through their pregnancy. And also MMR rates are low for the area. Again, some fantastic work that's been done by our health protection teams. Recently, we had MMR. We had the MMR outbreak in the area, and we had some innovative work that was done by health protection, primary care and colleagues to really look at doing some clinics in the communities and schools, and we saw an increase of those vaccinations, which was really positive. And again, we have similar things around oral health. Next slide, please, Lauren, which is in the next slide. Again, similar to Bermontoft's Richmond Hill. So we're finding that in terms of children between 0 to 17, we have lowest rates in terms of getting treatment, but then highest rates in terms of children going for dental emergencies. So again, a real contrast there, which I know that our oral health work is through the strategy, and our children and families team are doing some of that work. And literally got 5 minutes, so I need to speed up. The community and stakeholder voice. So again, fantastic feedback we got from communities. Next slide, Lauren. So similar things, and just to highlight, places of worship came up as a really positive place for people to help with their stress management, and a real sense of community for people, in particular from culturally diverse communities, who felt they were able to look out for each other and look out for their neighbours. And next slide, please, Lauren. And also, yes, so challenges. similar challenges that came through, so I won't go through those in any detail really, but what you would expect in terms of what people struggle with and the challenges, and you could see that through our data there and through the wider determinants of health data that, you know, these are real challenges for people who live in our communities. Next slide, please, Lauren. So, in terms of areas of focus, so I think this is my last slide. Again, not really any surprises for those of you who are on the call and work in the area. You will hear this a lot, really, in terms of issues that impact on communities. And if we can address these issues, then we can ensure that people feel better about living in the area. That can impact on their health, because we know those wider determinants are so important. It's not just about access to services, it's about how people feel and their mental health. And so if we can address these issues with all the stakeholders that we work with, because we already have the Clear Whole Build initiative in that area, and we have subgroups within those that are dealing with these particular issues, and we're hoping to set up a health delivery group as well. So there's some real connections that we can work with our stakeholders and really make this a reality for people, because I think for me and for Lauren, we don't really want to see this virtually sitting on Leeds Observatory. We want to really use some of this data and information to make a difference for our communities, because otherwise, what would be the point really of doing all this real hard work? The hard work starts after this. But yeah, so this is really just a whistle stop tour of the assessments. And so I'm going to pass you back to Lauren for the last bits. And I'm sorry we haven't really got lots of time for questions, but we might have a couple of minutes. Thank you, Lauren.
Thank you. So in terms of what happens next, as I've said, the full assessments and the executive summaries will be published onto the Leeds Observatory, hopefully by the end of this month, and we'll be sharing those out. We'll make sure that they're emailed out to partners. So obviously they cover the areas we've talked about. There's also assessments for Crossplatts Park, Holbeck and Armley, as I said. So if you're interested in those, they'll be coming too. If anybody is wanting to have a look at them before that, if you've got a funding bid that you need to get done or something like that, do get in touch with us. Our contact details are on the next slide, and we're happy to kind of share stuff with you to help with anything until they're published. And then it'll be about that collaboration with local partners. So thinking about like our local care partnerships and primary care colleagues and anyone sort of within the local authority and across the city who have an interest in these areas. We want to develop these action plans based on the areas of focus and kind of work together to co-produce what that looks like. There'll also be work internally in public health with our specialist teams, and we've got a few of them on the call today, but we'll be looking at kind of mapping our priorities with our specialist teams and thinking about influencing their work and how they can support this locality working as well. So I've put in the chat, but there is also a Slido here. So if you want to be involved in kind of next steps, so whether that's sort of a more in-depth look at one of the areas or sharing findings with your teams or wanting to get involved in actions and stuff, whatever it is, if you want to be involved, if you complete this form to let us know and give us your contact details, then we can be in touch with you when we kind of get to that point, which hopefully won't be too long. So as I said, this is in the chat if you want to click it, or you can scan it. I'm going to move to the next slide because it's 10:59. So our contact details are here. We'll be sharing the slides and they'll be sent out to everybody after this. So you'll have all of the content as well as our contact details. And then lastly, if you could complete, there's an evaluation form, which I will pop into the chat as well. But it'd be great. This just goes to our central team in the Public Health Resource Centre. Just so that we can sort of know how we did today. And then, yeah, you'll receive the slides and some other information from us. So it is about to turn 11 o'clock. I don't know if anyone's got any burning questions that they want to ask now, but if not, you've got our contact details, and we're really excited to hear from you and have you involved in the work going forwards. So thank you all for attending. today. And yeah, hope to see you all soon. Thank you.
Thank you. Thanks,
Thanks.
everyone.